everyone, so in this video we're going to take a quick look at the levator scapulae. So the first thing we need to do is go ahead and remove the trapezius. And there they are. We can see the left levator scapulae and the right here. Let's go ahead and look at your notes to outline the origin, and then we'll come back to this model. So I'm going to use red to label the origin. So the origin is the transverse processes of C1, C2, C3, C4. Let's go ahead and look at that on the model. So if we go ahead and zoom in and rotate a bit, we can see the origin of the levator scapula here. I'll go ahead and mark the attachment site. So we have one here at C1, C2, C3, and C4. Let's label the insertion in blue. The insertion of the levator scapula is the medial border or vertebral border, it can also be called. So medial border from the superior angle, which is here, to the smooth triangular space here. That is the insertion of the levator scapula. So here's the superior angle of the scapula, and you can see the levator scapula attachment. And then here is the smooth triangular space here, and you can see the levator scapula there as well. So let's go ahead and remove some of these other structures so we can really see this attachment. And there it is, vertebral border of the scapula, superior angle to smooth triangular space, the insertion of the levator scapula. Let's look at your notes for the innervation. It's innervated by the dorsal scapular nerve, which is a branch of the C5 root of the brachial plexus. So let's just go ahead and draw dorsal scapular right about here in green, as well as the C3 and 4 spinal nerves. That's tough to really draw accurately here with this pen, so let's go ahead and take a look at the model. So I've gone ahead and added back in some nervous structures. I've removed a lot of the cervical plexus because it's a little overwhelming. So remember, the innervation for the levator scapula is the dorsal scapular nerve, which comes off of the C5 spinal root, as well as the C3 and C4 spinal nerves. So let's look at dorsal scapular first. It's one of the easier ones to find here. Here we go. So that's the dorsal scapular nerve, and we can follow it, and what you will see is that it runs pretty close to our levator scapula here. Okay, so a piece of that is going to break off and innervate levator scapula. Also, we have C3 and C4. C3 and C4 are quite a bit smaller than C5 and C6, so if you can look how big C5 is, but here we have C4 here, and there's some innervation from C4 to the levator scapula, as well as here we have C3. So there's some innervation from C3 as well. So again, C3, C4, and dorsal scapular nerve innervate the levator scapula. Let's go ahead and address our actions. We don't need to go back to the notes for that. So if you see, we know the origin and insertion now, so if we imagine what would happen when this muscle here tightens, we would expect to see some elevation, of course. Look at that orientation of those muscle fibers. If that muscle fiber contracts, we would expect to see scapular elevation. It's also going to do downward rotation. If you imagine that the axis of rotation of the scapula is somewhere in this area, and then we're pulling up like this, that would cause downward rotation of the scapula. The glenoid fossa would move from here to maybe more like that. It would rotate downwardly. Lastly, there's going to be some adduction pull or scapular retraction. So again, yes, it's oriented primarily in a superior-inferior line of pull. It is slightly tilted towards midline, so there will be some adduction or retraction as well. So just to recap, the levator scapula causes scapular elevation, downward rotation, and adduction.